the difficulty in finding an affordable doctor. And I'd like to bring in Jaimie Taunoa. Jaimie, what's been your experience?
I guess, when are we going to take it seriously? How can we say that we're a lucky country and it's free healthcare for all when this is not the case? Something that should be a high priority for all governments is our healthcare, and we're in a position of crisis. And I feel like there's no action plan, and that we will continue to be worsened. Is this going to be Australia's new normal?
Jaimie, what have you experienced when it comes to trying to find affordable healthcare?
Just for myself, trying to get a marina. I went to my local GP, who's a bulk billing GP, $500 they wanted to charge me for that procedure. I went to the local Werribee Women's Hub, and for the same procedure, $380 out of pocket. I have a child that needed a referral to the Children's Hospital. 2 years. 2 years I waited to see the specialist. This is just my family, so and I'm just one person.
Well, first let me go to you, Mukes Haikerwal, on that point, and thank you, Jaimie, for the question. Why would the cost be so much higher at the GP than at a women's health clinic?
The issue with the general practice sector is it's been under the quash for an awful long time. So we've actually had yours and my rebate as patients has been stymied for at least 15 years. So if you look at it, it's grown by 0.5% a year. And of course, the value of that has then therefore been eroded. General practice is a small business, and it's important that we stay afloat to be able to provide those services. What's happened in those 15 years is that people have actually continued to provide that service without an out-of-pocket. Many people, a large proportion, you'll see the stats around 90, 89% of people getting their services without an out-of-pocket. And that's become untenable because we all know costs have actually increased. So what we have tried to do amongst the practices is to see how can we provide those services. And a practice like mine, we do have times when we are not charging out of pockets, but there are times when we have to, especially out of hours, especially late at night, when costs of these services increase. So the problems we have are, and I've heard this quite well articulated across the sector, is that people aren't staying. People who could work a bit longer are retiring early. People are not staying in, and we can't attract new people into the system. People who are being attracted from internationally have to go through many hurdles which are stymieing their process through. And of course, the younger people coming through medical school at 14% only, it used to be 50% plus, are actually not choosing general practice as a career. So we need significant support to the sector. The way we do our business has changed over time and will continue to evolve. But the core problem that we have is that you and I, as citizens, have been dudded for 15 years with a level of the rebate that we're provided for.
And I want to come to the Minister with a question on that rebate. But Anthony Dillon, let me bring you in on this because you're, in fact, I should point out, a practising psychologist. You've got some experience in the health system. Do you notice this problem about accessing GP services and indeed bulk billing GP services is becoming more acute?
So look, certainly I get a lot of clients, they'll get a referral from a GP. Depending on where they are, if like I deal with a lot of Aboriginal clients, often there's an Aboriginal medical service where they can get a GP, get a referral to me, and I will then see them via telehealth. So I often deal with Aboriginal clients, but certainly for many other people, yeah, I have heard of long waiting times, but it's not months or anything like that by the time they come to see me. Yeah,
okay, but it's obviously happening with other specialists from what we've heard. So Mark Butler, what's the answer to this, coming back to Jaimie's question?
Well, there is no one answer. There's the need to overhaul Medicare. because the system we have now was designed for the 1980s and the health needs of the country is very different. So we've been working with the sector over the last 6 months on a plan really to make it a very different type of system that responds much more to ongoing complex chronic needs of an older population with more chronic disease than the sort of episodic care we used to get in the 80s. So that's one. You can't just put more money into the existing system. You have to make the system better suited to the needs of the country today, and we will be doing that. At National Cabinet last week, the Prime Minister announced a package that goes part the way to responding to the Strengthening Medicare Task Force that we received earlier this year. Next week in the budget there will be more, because I said at the last election I've got no higher priority as a health minister than general practice. I think general practice is in the worst shape it has been certainly in the 40-year history of Medicare.
So does that mean the rebate, the Medicare rebate that a GP receives when you go visit them, will be finally increased above that, what is it, $39.75?
Well, I'm not going to announce what we're doing in the budget. Clearly there are financial pressures on general practice. There's also the change to the system we want to see happen to better reflect the needs of patients in the 2020s, not the 1980s. We've got to do all of that. And as Mukesh said, we've got to make general practice more attractive. I mean, if only 1 in 7 medical graduates are choosing general practice as their preferred career instead of 1 in 2, which is what it was not too long ago, if you think it's hard to find a doctor now, in 5 or 10 years, when the current generation is retired, it will be a real problem.
Well, just to, sorry to interrupt you there.
Just to finish, all of that ends up at the hospital.
Yeah.
Every failing in the health system around the community, it all ends up in the emergency department, crowding out an already very stressed hospital system.
I want to come back to some of the solutions here, but you mentioned...